Hello physios, I welcome you all to our channel Physio Vidyapeeth. We are back with our second lecture on heat therapy or the thermotherapy. Okay, so we will study about the thermal regulation. Okay, it can be either physiological or behavioral. Okay, so my name is Vijay Kumar and let's get started. Okay, so thermal regulation which occur in our body can be of two types. First is physiological and second is behavioral. Physiological, it has three parts, that is metabolic, vasomotor control and sweating. Okay, so for understanding this metabolic, you need to understand Van Hoff law. That is the Van Hoff law. Van Hoff law, which means this metabolic activity is directly proportional to temperature. That is, as we have studied in cryotherapy, when there was a reduction in temperature, metabolic activity was reduced and heat was reduced. So in that cases, sometimes shivering also occur. Why? Because excessive heat loss has occurred, and what our body will do, it will try to increase the metabolism by shivering, which will produce a lot of heat to maintain the core temperature. Similarly here, when the temperature will be high, okay, the metabolism, that is the metabolic activity, will again become high. A lot of heat will be produced, which is further radiated away from our body. So both the things are interrelated. क्रायोथेरेपी में क्या था कि जब भी कोल्ड पैक एक्सेसिव टाइम के लिए लगाया, बहुत सारी हीट जो है लॉस हो गई. देयर अकर एक्सेसिव लॉस ऑफ द हीट, एंड ड्यू टू दैट एक्सेसिव लॉस ऑफ हीट आवर body watch that there is no heat in the body, so it try to provide the heat. How? By producing shivering, that is involuntary muscle contraction. Here it will see, yes, temperature is increasing, so I will increase my metabolic activity of the body. So if activity increase, heat will be increased, the radiation of heat will increase to lower the temperature to maintain the core temperature. Okay, so this is about metabolic. It is simply based on the Van Hoff law. Second is vasomotor control. Okay, so again I will first of all explain you the cold part, then heat part. Okay, so this is artery, this upper, these two are arteries. Okay, I have labeled, you can please zoom out. While this is vein to the skin, okay, and this is the arteriovenous anastomosis. Okay, this is the arteriovenous anastomosis, and this is another important thing between the artery and vein, which is capillaries, that is papillary loops. Okay, so this part is artery and this part is vein, and here artery and vein is meeting, which is anastomosis, and here also it is meeting, but it is a capillary or the papillary loops. Okay, see, normally artery is having the blood and vein is also having blood, but there is the change in direction of flow. It is moving toward periphery while vein is moving toward the center of the body, that is toward the heart. Okay, so whenever there will be application of cold, what was happening? There occur vasoconstriction. So vasoconstriction, what it leads to? It leads to the reduction in the blood flow to the body part. So वहां से जो heat loss नहीं होगा. लेकिन यहाँ पर क्या होगा? Here occur a vasodilatation. Okay, vasodilatation occur, which will give a lot of blood to our skin. So our skin temperature will be increased, which will further reduce by two mechanisms, either directly by radiation or by sweating. Okay, so this is simple about the vasomotor control, and it is under the control of sympathetic nervous system, that is, it is called the vasomotor control. So metabolic में क्या हो रहा है, vasomotor में भी क्या हो रहा है, it is clear. And sweating, it is very simple कि जैसे जैसे देखो, if the body temperature is higher than the environmental temperature, we will lose the heat by radiation. But if the temperature of environment is high, it will give heat to our body. So how we will be losing that? We will lose it by sweating, which is the third mechanism of physiological thermal regulation. Next is behavioral. It is very simple. Behavioral means what adaptive changes we do. Okay, so for example, I am now standing in a very cold weather. I will be like this. I will be wearing a jacket and I will stand like this. Why? I will try to conserve my body heat so that not excessive amount of heat is lost. Okay, so I will be like this, that my body heat should be conserved. I will wear a cloth which will make air trapping between the skin and the cloth, so that my body heat is maintained in that air, that is heat is trapped. I will not allow that air to go out. I will zip the clothes, okay, and I will like this. In contrary, if I am standing in a very hot weather, I will be like this. What I am doing by this? This is allowing the air to move toward the body surface so that it get heat by the surface and move away. Okay, here what I was doing, I was like this, that all the heat which is close to my body remain close to me. Why? Because that air is heated and I want it to remain with me so that to maintain the body temperature. But here I will be like this. Oh, air need to come and get heat and go away from the body to reduce. So here I was conserving the air, that is trapping the air by clothes which are tight. But here I am allowing the air to come to the skin surface and go away by wearing the loose clothes. That is the behavioral modification, that is the cloth wearing modification which you do in winter and summer season. Okay, so this is a simple lecture regarding the thermal regulation. The lecture was thermal regulatory mechanism, which was related to the counter current exchange mechanism and homeotherms. Okay, that is we are homeotherms and receptors. We have studied receptor there, but here we studied that how the thermal regulation is occurring at physiological and at the behavioral level. So this is about the second lecture on heat therapy. In our next lecture, we will move further toward the heat therapy. So till then, you keep on studying. Thank you to one and all.